Good morning, everybody, and welcome. My name is Dale Johnson, the Information Systems Manager here at the Manufacturing Safety Alliance, and welcome to our webinar, COVID-19 Guidelines and Best Practices. Our moderator today is Lisa McGuire, Founder and Chief Executive Officer of the Manufacturing Safety Alliance of BC. Lisa?
Good morning, everyone. Thank you, Dale. I'm very happy to be part of this important Town Hall webinar today. Before we begin, I'd like to acknowledge and thank you, our industry, who are performing a vital role on the front lines, providing essential food and supplies for all of us. It is very much appreciated. Thank you for joining us today. A brief introduction of the Alliance before we introduce our webinar and guests. The Manufacturing Safety Alliance of BC is a not-for-profit health and safety association supporting BC manufacturers and food processors. We provide BC's manufacturers with education, resources, and training on workplace health and safety, online, on-site, and in open learning classes around the province. Our health and safety advisors, with a broad range of expertise, offer employers confidential support and are available to answer health and safety questions on the phone or online through our hotline number 604-795-9595 and as well connect via email. Our webinar today will talk about the recommended controls and protocols to address COVID-19 in a production facility, including what inspectors are looking for in the workplace. And then we'll hear how one BC food processor is implementing controls and best practice working on the front lines. We have 4 panelists joining us today, 3 from WorkSafe BC and CEO Jason Longden from Fine Choice Foods. To begin, I'll invite each of you to briefly introduce yourself and your role within your organization. Starting with Dan Strand, WorkSafe BC, Director of Field Prevention Services.
Yes, thank you, Lisa, and thanks to Dale and Manufacturing Safety Alliance for inviting WorkSafe BC to have this important conversation. I'm Dan Strand, the Director of Prevention Field Services, working specifically and primarily with the officers around the province, all 302 of them, in about 16 regions around the province of British Columbia.
Thank you, Dan. Moving forward to Tom Brocklehurst, Director of Regulatory Practices at WorkSafe BC.
Hi, thank you. Good morning. My name is Tom Brocklehurst, as mentioned. I am the Director of Regulatory Practices, or we just recently actually just changed our names to OHS Practices and Engineering. So my department provides sort of legal and policy as well as technical advice internally to prevention services. With respect to the COVID situation, we were very much put on the spot in terms of having to design and come up with an approach on inspecting and evaluating workplaces and their approach to COVID, and come up with that quite rapidly. So thanks for having me here today, and prepared to talk about where we are and how we're thinking about our compliance framework.
Thank you, Tom. Chris Spack, WorkSafe BC Director of Occupational Health and Safety Consultation and Education Services.
Thank you, Lisa, and thanks to the Manufacturing Safety Alliance for having us a part of this session today. So my name is Chris Spack, and as Lisa mentioned, I'm the Director of Consultation and Education Services at WorkSafe BC, formerly known as Industry and Labor Services for those who have worked with us before. So our department typically works at the industry level, works with industry associations, health and safety associations, labor organizations, and really leverages those relationships to be able to promote health and safety and move various initiatives forward. I have a team of about 60, and we are dedicated to what we would consider to be the highest risk industries within the province. And at this particular time, obviously, we have all hands on deck focusing on COVID-19 and providing support to employers and industries as we move forward, and more to come on that as we get further into the conversation. So thank you, Lisa.
Thank you, Chris. And Jason from Fine Choice Foods, CEO.
Yeah, good morning, everyone, and thank you to Lisa and the Alliance for giving me the opportunity to participate in this important topic today. I'm CEO of Fine Choice Foods. We're a manufacturing food processing company in Richmond, British Columbia. We've been around for 25 plus years, and we manufacture Asian-inspired appetizers such as spring rolls, gyozas, pot stickers, etc. I've been with Fine Choice now for 5 weeks, so of course I was thrust into COVID-19 the very first day that I started. So once again, thank you for inviting, and look forward to this dialogue.
Thank you, Jason, and all of you for being part of this webinar. Moving forward with our first question, Dan, what are the key things your officers are looking for in regards to COVID-19 when they visit a production or processing facility?
Well, I think we start that conversation by looking again at what the provincial health officer has ordered for workplaces and for the public health entity on the whole. And what I can say is we're promoting adherence to the provincial health officer's orders, but not enforcing them per se in workplaces. We're also, though, still focused on what we deem to be, again, the high-risk industries and industries around the province to ensure that we had a focus prior to COVID-19 to examine workplaces for where there were serious injury drivers and general industry drivers. We continue to do that work both in manufacturing as well as construction and healthcare. And so COVID has become something that we've turned our attention to and have embraced as you will, but we're still focused again on we are responding to work sites. We are out there and making our presence known. But with respect to COVID, what we are looking at specifically in manufacturing and production processing plants is it all starts again with the identification of risk and ensuring that that risk of a infectious disease is identified and that the employers is taking the necessary controls to reduce and eliminate that particular risk. The controls again have been reasonably identified via Bonnie Henry and the province of British Columbia. We're looking again for training, supervision, communication provided to workers, and a big focus on washing and hygiene and surface cleanliness and such, and the frequency thereof, as well as hazard reporting and things like contact tracing. So should someone get sick, how does that employer then ensure that others that might have been in proximity are alerted and necessary precautions taken that way. So a lot of what we've done is sort of turn the provincial health officer's orders into a complementary set of strong recommendations in workplaces, but again, recognizing workplaces know their business the best. In manufacturing, sort of the cleanliness of the facility is the top priority primarily, obviously, as well as occupational safety. So we're well ahead in manufacturing to be on top of this particular challenge.
Thank you, Dan. Tom, what are the most common compliance questions and concerns you're hearing from manufacturers and food processors, and how are you responding?
I think a common theme that we hear is around personal protective equipment, PPE. What masks, what gloves, do we need respirators, questions like that. And when we get those types of questions, we tend to want to try to refocus the conversation a little bit. When we're looking at controls put in place at the workplace, we really want to start sort of at the top down and look at sort of the hierarchy of controls and all the decision making that's gone on along the way before we start having that discussion about PPE. So we really want to make sure that employers have had that opportunity to really think through, does this work need to be done? Does it need to be done this way? Are there engineering controls to be put in place? Are we scheduling workers the right way so they can avoid each other? What administrative controls are put in place? And to Dan's point, making sure that good hygiene practices are put in place. Making sure all the surfaces are cleaned and re-cleaned, and workers have the opportunity and are instructed to wash their hands as often as possible, use sanitizer if it's available. So we really want to walk through all that decision making before we start thinking about what masks, because I think the temptation is that when we start talking about PPE, everybody kind of goes to that and thinks of that as kind of the magic bullet solution. It really isn't. It's kind of the lowest level in terms of protection for workers. So when you do have those situations when workers, if it's unavoidable in some way that they have to be within that 2 meter distance, encroach upon that physical distancing, yes, think about PPE, but let's not, kid ourselves that it's going to be the solution to protecting workers fully. Ideally, you have all those controls in place before you even had to think about PPE.
Thank you very much, Tom. Chris, how can plant owners and operators best work with WorkSafe BC to address concerns relating to compliance, claims, and refusal of unsafe work?
Thanks, Lisa. I think there's a number of different avenues that the employers and workers can access WorkSafe BC resources. First of all, I would suggest that our website is an excellent resource to be able to look at. So since the beginning of this, we have been putting an immense amount of effort into getting as much information onto our website as possible. If you go right onto our homepage, then you will see right in the top banner there a link to our COVID page. And if you go onto the COVID page, there's a lot of information on there, general health and safety practices that are broken down by what employers need to do, what workers should do, staying safe at work, providing industry information. There's a new frequently asked questions document that we've put up on there, and lots of information on there about the processes related to refusal of unsafe work. We also have some pages that we have developed specifically for industries, where we see those industries that are still operating. We've tried to focus in the higher priority areas. Manufacturing is one of those areas, so we do have a page that is dedicated to manufacturing and has some information related to COVID within your sector. And then we've also got some claims information on there as well related to COVID. So we are getting questions coming through around how claims are going to be handled in this situation and the impact that might have on employers. There's information there as well. So I think that's probably the starting point for employers to go to. If you're unable to find the answer to your question on our website, then absolutely you can connect with us through our prevention line. That is probably the best way to come into the organization. It's tracked that way and then sent out appropriately for officers or others within the organization to be able to respond to the queries that are coming in. So that's an avenue as well. And I would also recommend that that you're connecting in with your officer as well. If you've got a relationship with an officer already or have a connection point in with the local WorkSafe BC office in your area, then I recommend that you're connecting in with them as well. And they will be happy to provide, we will be happy to provide response that way. I should also mention that, with Dan, as he mentioned during his little spiel there, that he's got about 300 officers that are out there doing consultation with employers. And I should mention that our team in Consultation Education Services, which is typically, as I mentioned at the beginning, focused at the industry level, where we're working with health and safety associations, industry associations, and labor organizations, we are also recognizing that at this point in time, there is a need for everyone within prevention to get out there and provide support at the employer level as best as we can. So our team is out there connecting with employers. We're focusing again on the essential services list that was announced by the provincial government on March 26th and focusing in on those industries and those employers. We are conducting our consultations remotely, so calling into employers and asking them about what they've communicated with their workers related to COVID-19, what controls they've put in place to prevent or reduce the risk of exposure in the workplace, discuss any actions that they've put in place in order to prevent the spread of the disease amongst workers, as well as activities and controls to prevent possible unsafe work refusal. What we're also doing is connecting in with the joint committees at the employer level and hopefully a worker representative as well, to be able to talk about which areas might be a priority for the employer to focus on. So of all the tasks, where is the greatest potential exposure to the disease, and then helping to identify some solutions or controls that can be put in place. We also recognize that there are psychological impacts of what's going on right now, increases in anxiety and depression and so forth. And that can also lead to distraction in the workplace. So not only addressing the issue of psychological safety, but also recognizing that when people's minds aren't completely dedicated to the task at hand, they are also potentially creating other high-risk situations in the workplace that may lead to other injuries or illnesses. So we're also trying to address that with employers as well, and then direct them to available resources, not only our website, but also industry websites such as the Manufacturing Safety Alliance. You guys have put together a great website with information on it for employers, and then also the provincial websites like the BC-CDC and the Provincial Health Office. So I think those are some ways that that employers can connect in with WorkSafe BC and get the information that they need in order to keep their workers safe while we're going through this particular situation. Thanks, Lisa.
Thank you, Chris. Very informative. Thank you. Moving forward to Jason, working on the front lines, what are the most significant health and safety challenges you're facing at Fine Choice Foods? And what are the most important changes you've made as a result?
Yeah, thanks, Lisa. You know, of course, you know, challenges, you know, first and foremost, you know, this is unprecedented times that have challenged us in the food industry in ways that we've never experienced before. So I'd just like to start by, you know, firstly thanking, you know, frontline workers, essential services, manufacturing companies, and specifically food manufacturing companies and our employees at Fine Choice for continuing to support and show their commitment to, you know, servicing our consumers with essential food products. I think in terms of, you know, what we've experienced, you know, to go back to, you know, some of the comments that Dan and Tom and Chris have made is really focusing on doing, you know, very detailed and good risk assessments. You know, make sure that you're understanding what areas of your facility are particularly higher risk and what controls you can put in place to, you know, control and manage those risks. And we really took kind of a three-pronged approach using, you know, administrative controls. So things like daily health checks, you know, checking in with employees, making sure that they're feeling fit. And if they're not feeling fit, making sure that you've got policies in place that direct the organization for those people to stay home until they feel better. And then have a solid return to work program for when they are feeling better and want to return to the workplace. So use some of the tools that the health office has provided, the online testing tool, online checklists, and then use a collaborative effort to make those decisions. Having one person make a decision that somebody is sick or feels unwell can be somewhat subjective, so we're using a more collaborative team approach to make those decisions going forward. The second one is really physical controls, and so looking at how we can create better social distancing, whether that's opening up boardrooms and meeting rooms to provide more lunchroom areas for staff, trying to stagger start times for employees so that they're not, you know, running into congestion areas when they're coming into the facility, and trying to do whatever social separating you can in the workplace, whether it's, you know, having meetings with teams, try and keep that separation as good as possible. Obviously, we're a food manufacturing facility, so our hygiene is already at a high level, and really thankful that we're already working in that kind of environment. But take those hygiene standards to the next level. You know, really, you know, focus on areas that you wouldn't necessarily focus on usually, like door handles, you know, computer stations, phones, stuff like that, to making sure that you're sanitizing those areas effectively. Of course, there's PPE, and you know, my colleagues have mentioned that already. We've made surgical masks mandatory in the facility, and we've offered face shields as an additional protective measure. We partnered with a company in Langley called Method Innovation, and they provided face shields to us very quickly. And so we've offered those PPE options as well to our employees. And then you've got the process control side, which is eliminating non-essential visitors to the facility, making sure that your HR processes are in line and consistent all the time, assessing your supply chain risks with vendors, suppliers, and understanding what risks you're at there. Obviously, communicating with customers, making sure that they understand where your business is at and what you're doing to provide their essential needs. And then contingency and preparedness. So, you know, what do we do should we have the unfortunate circumstance of having a positive hit? What are we going to do as a company? How do we manage that through? And how do we communicate that to employees? So that's probably some of the challenges that we've faced and how we've addressed them. I think communication is a really critical piece, and I believe we're going to touch on that in a little while in terms of, you know, increasing communication levels within the business. So that's kind of how I would position that right now.
Thank you, Jason. And once again, thank you and Fine Choice Foods and workers on the front lines, really providing a vital food source for all of us. Thank you. I'd like to thank all of the panelists for being part of our webinar. Your collective knowledge helps all of us with valuable concepts to apply to our operations to help keep our workforce safe. Moving on to some questions that we have from our audience. Would like to ask your thoughts, maybe starting with yourself, Dan. What are the most important controls officers want to see in the plant?
Yeah, again, it's we come down to communication. It's want to obviously ensure that the risks are being discussed and there's an understanding of the specific risk in that environment. We want to ensure that we're seeing that hierarchy of controls conversation is being had, and that, again, we're not just simply relying on PPE as being the sole determinant of you know, minimizing that exposure. The hierarchy controls to manage the 2 meter sort of separation as well. Like, you know, is it possible to eliminate or create physical segregation and procedures and such, again, prior to getting to PPE. We want to see, yeah, the washing equipment and all of that cleanliness standards kept. We've seen examples of sort of COVID officers on sites that are their sole task is to ensure that tools and equipment is wiped down and that people remain at suitable distance where appropriate, and every you know, discussion and every effort is made to kind of maintain that separation, and where it's not, there's thought as to minimizing that interaction. You know, aligning the cleaning procedures and the frequency with provincial health protocols, food safety and sanitation requirements. Again, a bit of a distant from WorkSafe BC regulation, but very much connected. And so, again, I reflect on the fact that the quality standards and all the rest, the HACCP and the rest of food manufacturing standards require a lot of these processes to be in place already. And on also evidence of training and that oversight and just adherence to the protocols. So communication becomes that which we see most frequently, that there's a misunderstanding or people just don't truly understand what they're meant to be doing. And just that ongoing adherence that way at the site level to communicate. We also want to ensure that the Joint Committee has a voice, the workers have a voice, and again, that ties back into communication, that there's conversations being had, issues are being brought forward, rectified, dealt with at the site level. We've had a few right to refuse. Again, it's a, you know, a key responsibility for and a right for workers. But similarly, we do also endorse and encourage employers to take that that right seriously and maintain the posture of the joint committees and those conversations and those frank and honest conversations about protection of worker safety. So that's generally what we see most frequently and want to see. Thanks,
Dan. Very comprehensive. The next question is for you, Tom. If we have an employee test positive for COVID-19, what steps should we take?
Well, obviously, the first is that employee should not come to work, and that's fairly fundamental, I think, in this whole process. And you know, the direction from the Public Health Office has been fairly straightforward on this since you know, since this began. So obviously, the first way to minimize your other employee's exposure is to not have that employee come to work. They are going to have to self-isolate and stay at home. You know, I think the direction is 14 days at this point, but you want them to be symptom-free before they come back. You know, if they are experiencing symptoms, they should be calling into the public health line and getting, you know, getting some clarity there on whether they sort of fit the profile of the disease, or if it might be something else, or whether they need to, you know, potentially get treatment in hospital, which might result in some testing to make sure that they do have the disease. You know, the public health office does want to record and be aware of all these things. So, you know, back to your role at the workplace, you know, it is basically the employer's responsibility to keep that worker away from the workplace where they might, you know, transmit the disease to others. I think that's relatively straightforward. It's a little more challenging on the return to work side, that if the worker's been out for a while, making sure that they are disease-free. So I think there's still a bit of an issue there, a bit of a struggle in understanding just even the nature of the disease, whether it comes back, and you know when exactly you're clear of it. But it should be, you know, it is at least that 14 days, and you know, make sure that they have had the opportunity to get as well as they're going to get.
So Tom, just on the return to work, is there guidance on just, you know, what processes we can put in place or suggested to be put in place to help support employers in understanding how to create policy or at least mechanisms around this?
Well, it is a bit of a balance here, right? So you do want to make sure that that worker is symptom-free and has been away from work for the required period of time. So it may be a situation where you want to be a bit more cautious with that worker, make sure that they're you know, kept at a distance from other workers. Again, it's not no, there's not a whole lot of clarity at this point exactly on I guess sort of the sort of long-term effect of COVID-19. So we would basically just recommend caution. Make sure that that worker is completely symptom-free, has as clean a bill of health as we're going to get, and make sure that they're well managed on the return to work.
Thank you, Tom. Chris, how do we adapt general guidelines to specific questions, recognizing it's not always possible to maintain the social distancing between workers?
Thanks, Lisa. I mean, I think there's a lot of information out there, as you say. We've got lots of general guidelines that are up on our webpage, on your webpage, Manufacturing Safety Alliance. Lots of information on through the BC CDC and the Provincial Health Office. I mean, I think for the most part, at a general level, employers, workers, the general public are fairly aware of what the requirements are. So when we get down into the specifics, I mean, that's really where it comes down to you know, the details of the particular situation that the employer is faced with on their work site. So I would say as a starting point, it's probably a conversation for the Joint Occupational Health and Safety Committee, if there is one, or if the employer is small enough where they don't require, then at least a worker health safety representative speaking with the employer, having a conversation around the particular situation and what we know from the provincial sort of general guideline approach, and utilizing that information to try and come up with solutions. Again, utilizing the hierarchy of controls that both Dan and Tom have referenced. That's really the process that we want employers to go through, is to plan the work and to really work through that hierarchy and try and put in controls that are going to minimize the potential exposure as best as possible. If the Joint Occupational Safety Committee is unable to come to a solution that they think is going to work for a particular issue, then at that point I would suggest that they are going off to yourselves at the Manufacturing Safety Alliance, connecting in with your advisors, as well as other advisors through other organizations within manufacturing, industry associations that may have some information to be able to assist. And if the particular challenge or the question that that employer is faced with is if we're unable to come to a solution through those avenues, then again, coming through to WorkSafe BC through our prevention line and asking the question that way, or connecting in with an officer, or even with us through consultation education services to work with the Manufacturing Safety Alliance or others to try and come up with an answer to the question that's going to help the employer as best as possible. So I would suggest those are probably the steps that an employer could go through to try and deal with these issues. We recognize that there isn't a perfect answer to everything right now because there's still a lot of unknowns, but collectively we are all trying to do the best we can to support industry and allow them to keep the doors open and maintain the provincial and federal requirements and guidelines. So that would be where I would probably suggest employers go.
Thank you, Chris. Just looking at what we've seen at the Alliance, some real innovations, such as including plexiglass on tables in the lunchroom to maintain the distancing. I know we've seen on the lines just barriers being put between workers with plastics or related substances to try and keep that distancing. So real innovations, and just to add to that, to be able to contribute to ensuring the hierarchy of controls within an engineering environment. So just to add to what you've shared, Chris, thank you. And moving on to you, Jason, how have you addressed your staff's anxiety to help them keep them coming into work and maintaining motivation?
Yeah, thanks, Lisa. This is a really important subject, and something that I'm really proud of how the management team here have really managed that particular issue. When people think of COVID-19, the disease is really a physical disease, and it's equally important to look at the impact from a mental health perspective within the workforce. Managing people's anxiety, their worries about coming to work every day and being concerned about becoming exposed and taking that, back to their family is really, really critical at this time. And so, what we did predominantly was, first and foremost is we have a daily war room style meeting with the management team every morning to talk about what's going on in the facility, what feedback are we getting, what information is coming, new and updated information from the government and from the province in terms of expectations. Doing management updates back down and cascading through the floor employees. And what's equally important is when you consider businesses that are ESL in nature, is that those communication vehicles are in appropriate languages so that people understand and see what's kind of going on. Active listening. It's not always easy to be an active listener, and I think being sensitive to people's worries and concerns at this point is really, really important. And so as a management team, being visible, making sure you're available, approachable, where leadership really becomes the constant in this situation to create calmness. I continuously remind all of the team at FindChoice that because we have high hygiene standards just as a norm, I feel incredibly safe being in the facility because of the processes that we've got in place on a day-to-day basis. So, managing those anxiety levels is incredibly important and should be a top priority as well as managing the physical risks. So I would say that's kind of, just communicate and over communicate all the time.
Excellent, Jason. Really valuable information and really important. Our mental well-being, critical, especially when we have our changing environment around us with this new virus. Moving on to another question. What are the potentially riskiest points for transmission of COVID-19 in a manufacturing plant? So perhaps Dan or Tom, would like to take that question?
This is more again for the scientific community to have that conversation. And there's, the science is varied as to, they speak right now about droplet transmission, and but the concern that people have currently is the efficacy of airborne transmission, and still the science is yet to prove the fact that, again, it's transmission of this virus is it's communicable through airborne means, and so that's the challenge that employers and workplaces and WorkSafe BC has, is to what extent does airborne transmission create the conditions for transmission of this virus. And so right now, again, it's horizontal surfaces and droplet contact transmission, direct and indirect, which is sort of the basis for hand hygiene and social distancing and physical distancing and such. The aerosol aspect of it is what is driving a lot of the confusion, and the science community is kind of mixed on it. Precautionary principle would suggest that we take all precaution until we're 100% free and clear and understand fully how this particular virus transmits. But the fact of the matter is, it pushes up against an aspect of inventory control and frankly personal protective equipment, and where we're funneling the provinces. All of its effort is to ensure those that are frontline dealing with COVID patients are actually protected. And so it's quite, I guess, a phenomenal thing, outside of even WorkSafe BC, me as a member of the public watching what's happening around the world with respect to provision of protective equipment for healthcare workers. And it's a challenge for manufacturers even to deliver those product. And so right now, there's again, we're talking about droplet, direct and indirect transmission, and airborne is up for discussion, still to be verified.
Thanks, Dan. I know experts working around the world to learn more and more about this virus, and share to all of us to look at how do we apply that learning. Moving on to the next question, what considerations, obligations, and guidance do you have for employers when employees come to work with their own PPE? For example, their own masks and N95 during COVID-19. Tom, do you have any insight into this question?
Well, I guess, if they show up with their own PPE, I mean, I guess the employer, what they want to do with that. I mean, ideally, it would fit into whatever program that employer has around the provision of PPE. So, they have to, obviously, if it's going to be a respirator style, it needs to be fit tested. The worker has to be instructed on how to use it properly. Kind of goes back to the point I was making earlier, that sometimes, just having the PPE makes workers feel a little bit more invulnerable than maybe they need to. So that, if they show up with their own PPE, making sure that they actually fit into the rest of the controls around COVID that are going on in that workplace. So making sure that they're fully instructed on what those controls are, and making sure that if they are going to wear their own PPE, that they have the right fit test, they have the right training, they use it correctly. But it is up to the employer at that point to decide how that's going to fit. Maybe a situation where they might not want to have the worker do that. They can't be confident that it's good quality PPE. You maybe have one worker that has something fairly elaborate and other workers haven't been provided anything. That may be something that, maybe a bit of a sticking point for people. But again, we kind of leave that with the employer to manage.
Thanks, Tom. Jason, do you have anything to add to that, being on the front lines with seeing this firsthand?
Yeah, sure. I think, our position is that as an employer, you have an obligation to, protect employees and provide appropriate PPE for those people. And so, we took a position that we're going to make sure that we've got adequate supply, and we've been very fortunate that that we've been able to gain supply of these important PPE pieces. And we made it our policy that we will provide that protective equipment to our employees. We validate that the spec is appropriate and that the fit is right. And so we haven't really allowed external PPE to come into the facility. We want to be sure where it's coming from. We want to be sure on the source and the quality of it. So we just took a position on that internally and said we were going to make sure we provided that.
Thanks, Jason. Another question, what should we consider in performing first aid in this new environment? Chris, do you have any insight into this question?
Thanks, Lisa. I mean, again, it's obviously going to depend on the particular incident that occurs and how serious it is and whether or not it's going to be life-threatening for that individual. But we do want, just with any other activity that's occurring in the work site, we want the employer to have a plan in place on how they're going to approach first aid issues that may come up and go through that hierarchy of controls to be able to consider what control measures can be put in place to be able to allow that first aid to occur. I would say that process is probably would probably apply in that same situation. Now, of course, with first aid, we know that more often than not, first aid is going to require close contact between the individuals. And again, we want the employer to be thinking through and having a plan in place prior to those situations occurring to be able to minimize the potential for exposure. But of course, the particular situation or incident that occurs is going to have to be determined at that point in time on how serious it is and whether or not it's life-threatening and whether or not the worker is the first aid attendant is going to have to get right in there and provide the first aid as needed. So yeah, I would probably say that would be the approach we want to take. I don't know if Tom or Dan want to add anything to that one in particular. Good.
No, this is a question we fielded a few times now, particularly in environments where employers that may not have a robust PPE program already, so they're kind of grappling with what to do with this particular situation. So obviously, when you provide first aid services, you deal with an injured worker, you're obviously going to be within that physical distancing. So it becomes a question of how you protect both workers potentially from each other should one of them actually have COVID-19. So there is the prospect of one or both the patient and the first aid attendant using surgical masks or other facial coverings as part of the treatment there. Obviously, there's a question of practicability. If someone's really injured, you're not going to be running around putting a surgical mask on them just to avoid a potential exposure. But there is that prospect of using facial coverings. But also, just kind of to go back on the point about the physical distancing. So we've actually we have regular contact with the public health officer, and we're getting sort of getting behind the scenes on a lot of the advice they're providing. So there's an awful lot of anxiety, to Jason's point, around COVID-19 and getting within that physical distancing and making sure that's well managed. And we want that to be well managed. But, temporary or transient contact or workers within that 2-meter range, it elevates the risk slightly, but it doesn't turn that into a high-risk situation. So it is manageable that way. So what are good practices globally for the population at large? We've taken those and we've turned those into, very specific workplace practices, which is good. We want to do that, but we do have to acknowledge that just because you get within that physical distancing on a transient basis doesn't mean you've actually created a high risk of actually contracting the disease. So these things are manageable.
Thank you. Another question related, how do you, to avoid large gatherings, how would you advise to proceed with monthly Joint Health and Safety Committee meetings? Any suggestions on this, perhaps yourself, Dan?
Well, by all means, yeah, no, we advocate for and request and require those meetings continue. And, I think we have one of the examples of tools that are in place now more than ever are either conference call capability or Zoom, Microsoft Teams. It just kind of goes on and on. Skype. There's whatever sort of mechanism is available for employers to minimize having folks come into the office for the purpose of that meeting is to do it remotely. We'd certainly advocate for that. And to utilize the tools that, again, we're experiencing right here. Again, I can hear you, see you, all the rest of it. It works well from that perspective. Conference call as well is another avenue, but those meetings need to continue, and minutes need to be taken, and they need to be posted, and concerns need to be allayed, and communication, both worker to employer and vice versa, need to have happen to, again, reduce that anxiety level, and to just show that leadership that Jason was alluding to, that we certainly appreciate and love to see on work sites, is employers and workers working collaboratively to reduce the anxiety. So utilize the tools that are available and out there, and I'm not going to promote any one tool over another, but conference calling ability works just as well.
Thanks, Dan. Jason, any additional insight into, how are you holding your joint health and safety committees? Because you mentioned how vital they are for communication and employee engagement.
Yeah, again, I think we're fairly fortunate because we've got, fairly large meeting rooms at Fine Choice, so we're able to, distance the chairs away from each other. I think to Dan's point, if there is the necessity to use technology, I think that's a great solution. Kind of more difficult, when you're dealing with, plant floor employees, but definitely an option. So I think, we're finding that we're able to still, hold meetings and still be functional while, keeping a social distance away from each other in those meetings. But technology is definitely an option. Definitely the anxiety level is there. I mean, everybody feels it, right? Like, we're in the same room. We could be, if we are showing symptoms and there's droplets, like that could be an issue. So, I think, again, it goes back to managing, communication. It goes back to, managing the anxiety level, making sure that people are fit, and if they're not fit, that they're not around other people. And that's no different whether it's a management meeting, a joint health and safety committee meeting, or any other, gathering of such. So I think, one, technology if you can't be in the same space, and then secondly, making sure that people that are connecting with each other are fit and not showing any symptoms of COVID.
Thank you, Jason. The next question speaks to a resource on a policy. Does WorkSafe BC have a return to work policy for employees that have tested positive for COVID-19, your employees? And if so, can it be shared with the rest of BC? So perhaps, Chris, you have some opportunity to answer this question.
Yeah, thanks, Lisa. I'm not aware of a specific policy that we have in place related to COVID. I'm also not aware of anyone within WorkSafe BC who has contracted COVID-19. But having said that, we're also maybe in a bit of a different situation than most manufacturing employers in that we have deployed our workforce to the home for the most part. So most of us are working out of our homes. And in which case, if there were any situations where an employee contracted COVID-19, we would follow the provincial guidelines of going through the 14 days of quarantine and recovery, and then the worker after that particular situation would be able to come back to work. But in this particular case, again, most of our staff are working from home, so it wouldn't be a case of coming back to the workplace. But again, at this point, we would be following the provincial recommendations of the 14 days of quarantine and being symptom-free.
Thank you, Chris. Next question: does a barrier allow for less distance required between employees? Can a non-essential business reopen upon inspection by a WorkSafe BC officer if sufficient safeguards are put in place, like physical barriers? So Dan, question over to you.
That's one that actually we're having the conversation right now, is what might be our role in supporting businesses as they desire to reopen. But what I will say is we are not prepared to be standing up against and sort of dismissing the provincial health orders. And so that's guidance that we have to respect as well from that perspective. And so we take the lead again from that agency and that group and that table from that perspective. So we don't necessarily be in a position where WorkSafe is suggesting they're free and clear and all the rest of it. We more so want to turn that equation around, even internally, as we have these conversations, is what's the next sort of 4 to 6 weeks look like as, Dr. Bonnie Henry suggests that there's some lessening of restrictions. What does that look like, and how might we support those businesses? I'm going to suggest again that those employers really are just examining all of these conversations and all of these components that we just discussed, and have more so probably had the conversation with the employees who are returning back into that work environment to convince and to help them understand all of the controls in place. In all likelihood, it's going to be, all these controls are sort of well situated, and employers can sort of display and show that they have taken all necessary steps and precautions. But it's not going to be so much that you have to convince WorkSafe BC. It has to be that you have to convince the employees who are then going to be returning into those work environments. And we're seeing it already in things like education and education assistance and stuff. And just the concern that people have to say, it's either I'm working from home or I was laid off, and to come back into the workplace, I have concerns. And so the first thing they do is call WorkSafe, where we would rather see they call the employer, have the conversation, and lo and behold, those concerns are allayed, or there's understanding of the steps that have been taken. So we're not in a position right now to suggest that WorkSafe is going to go up against the provincial health officer and start this determination of which businesses can open and close and all the rest of it. We will await sort of the word, and that would be my boss and the boss above that too, before we start those conversations. But more so, I just want to again implore, and it's no one on this line, but other organizations who wish to kind of examine their work practices, they'd be well advised to take all these necessary precautions, do the examination of the work environment and the risks therein for COVID. But I'm prepared to suggest that we expand that into all risks that they might sort of have within their work environment. With that, then, do those employers have something to talk about their returning employees or new employees that come into their employ, to convince them that safety is our top priority and we wish to provide that safe environment? That's sort of the safety culture coming out in that conversation. So I went around a little bit in a circle, but I can say that, yeah, we're not prepared to, run up against Bonnie Henry's orders and determine who's open and who's closed from that perspective, who remains closed, if you will.
Thank you, Dan. Just looking at returning to the return to work policy that we talked about prior to this question, from a practical application perspective, Jason, do you have something further to add on what you're doing on the front lines as it relates to a return to work policy for employees that have tested positive for COVID-19?
Yeah, sure. So this is probably the single biggest, anxiety point that we've got feedback from staff in terms of if somebody's felt unwell, whether they've been off for a week or self-isolated for 14 days or been in contact with somebody else who's been unwell and made the decision to self-isolate themselves as part of the process, is, what kind of valid return to work programs are we going to put in place so when that person returns to the workplace, that our employees collectively feel like we've taken adequate measures. Now, we're not health professionals in any way, but again, what we did was, we took, the simple advice of what the health office are doing in terms of symptoms and what really represents somebody being unwell. And, we developed a fairly, I would say, simple return to work checklist that every employee has to, go through when they're coming back to work. They have to sign off against it so that that they understand that, the information that they're providing to us is real and genuine. And I think we've been able to alleviate some of the anxiety, although not all of it, because I don't think there's anything that we can really do to take away that anxiety level completely. But it's definitely helped with reducing some of that anxiety. So just a simple return to work checklist that we're going through with every person that comes back.
Thank you, Jason. Really helpful information. Next question, is temperature screening an acceptable method to avoid people with elevated temperatures entering the facility? And I know at the Alliance, we've had several questions from our members on this. Tom, perhaps have a perspective on this?
Sure. Yeah, so we've heard that question a few times from various quarters. It isn't a practice that, we're either in favor of or against. If that's something you want to do because we believe that that's going to protect your workers the best way possible, then that's one thing. I kind of question the efficacy of kind of stopping everybody at the door and going through a temperature check, rather than sort of managing your workforce and having them self-disclose when they are experiencing symptoms. I think you want to involve your workers collectively and collegially as part of the effort here, and work with your joint committee to make sure you have good practices that are sort of workable with your employees, and sort of having this kind of checkpoint at the door where you get screened. I think maybe for a lot of employers it's going to put a whole different kind of cast on how the workplace actually runs. So, we're not saying one way or the other, don't do it, but as a workforce management tool, it seems pretty clunky to me anyway.
Okay, thanks, Tom. Next question that talks about employee privacy. What information must we give other employees who may now be exposed to someone who got sick? How do we handle the rest of the staff if one worker does get sick? Anyone from WorkSafe BC would like to comment on that particular question? It's certainly one that we've also received as well at the Alliance.
Again, it's Dan here. It's not really a WorkSafe BC question per se, but it is privacy, and you obviously, if anyone has illness or disease or any other sort of concern that way, we maintain their privacy, COVID or not. From that perspective, when contact tracing, people don't need, we're not divulging necessarily who. We're just trying to get some details of locations and such, but to maintain privacy, that's again beyond a WorkSafe BC matter. From that perspective, employers do need to, yes, take those concerns seriously, and again, you think of it as if it's yourself who was experiencing symptoms, kind of the impact it would have on you and what have you. So those matters are again left for a different environment, not so much an OSH regulatory one, but they are concerns nonetheless, and you do have to respect them by all means.
Thank you, Dan, and all of you on the panel, and everyone online for your questions. Unfortunately, that's all the time we have this morning. If we haven't answered your question yet, we will get back to you with answers by email or on our COVID-19 frequently asked questions page later this week. If you have any other health and safety questions, please contact our health and safety support line. They are available to assist you at the number that you see on the screen, 604-795-9595, or reach out to us through our website at any time. Moving on to our upcoming webinars, before we go, you may also be interested in our 3 webinars that is coming up in the next week or week and a half. First, next Tuesday, April 28th, Respiratory Protection Basics by our industrial hygienist, Jasmine Kelsey. April 30th, Government Supports to Industry by BC Minister of Labour, Harry Bains. May 5th, Ergonomics, Tips for Working from Home by our ergonomist, Era Potter. Thank you for joining us. Thank you very much for being part of our webinar today. Please take a moment to share your feedback and suggestions in the brief survey in your inbox. Tomorrow, we will send a wrap-up email with a recording of the video and links to the slides and related resources, including these upcoming webinars. Feel free to share these and follow us on social media for more news, resources, and future events. Thanks to all of you. Have a very safe and healthy week.